Welcome back to another episode from the Optimal Body Podcast. I'm Doc Jen.
And I'm Dr. Dom.
And today we're talking about hip osteoarthritis, something that I think affects a lot of people. And understanding what you can do and best practices for this is huge. Now we're going to talk through some of the research on this. However, we have specific videos on hip pain and what you can do. So don't forget to hit the subscribe and look through our videos because we have so much, particularly if there's an exercise where you're feeling some kind of pain and you want some cueing to help you be able to better do it. We have videos on that. And if you have other recommendations, please leave it in the comments below so we know how we can better help you.
And honestly, hip arthritis, this is so tough, looking through all the research. And we have someone on our team who does very thorough research for us. And there is so much research on hip arthritis, the condition, on hip arthritis with different therapies and exercise. And it's really tough to dice through because so many of the studies might have somewhat conflicting results and takeaways and conclusions, and it can be a real mind boggle.
I encourage you to listen to this with an open mindset of what you can do and what is the best practices for you as you continue to listen to this, because at the end of the day, there is no, okay, you have hip arthritis. Here are the 3 exercises you should be doing.
Yeah.
Unfortunately, it doesn't work like that.
We would love if the research pointed us to 3 exact exercises that everyone could do. It's got to be specific to each individual person. And that's what a lot of the takeaways and discussion was surrounding these studies is that, okay, here's what we found, but based on all the research that is out there, here's kind of our take.
Like 1 in 4 people will have hip osteoarthritis, and obviously it's more prevalent as you increase in age and you get older. That's how it's quite normal to see tissue changes, and with tissue changes are going to come some arthritic changes, because if we reduce the cartilage that is supporting that joint, we might have some more interaction between the joint, causing potential bony growths and limitations in movement. So that is, some of the clinical signs and symptoms is that you're going to have limitation in your range of motion, tenderness around the groin. Typically we're seeing it over the age of 60, and it's mostly predicted in the presence of a radiographic hip osteoarthritis to be able to really see it in an x-ray.
In the research that we did, there were 2 massive studies. So Framingham study showed that 15.6% of patients with frequent hip pain showed radiographic evidence of osteoarthritis, and 20.7% of hips with radiographic hip arthritis were frequently painful. So only 1 in 5 people who actually had it show up on their image actually had frequent pain, and even a lower amount of people who were frequently painful had it show up on their image, which basically says that what is showing up on your image is not equivalent to the amount of pain you have. There was another study, the Osteoarthritis Index, that had similar results. Less than 10% of people with frequent hip pain actually had radiographic arthritis, and about 23% of people with radiographic hip arthritis had frequent pain. So that all just going to say that the level of deterioration or degeneration you see on the image doesn't have to be or may not be equal to the amount of pain you're feeling.
Which is consistent with what we see across, MRIs.
All sorts of different joints.
The image is one portion, but don't let it determine everything in what you're going to feel in your outcomes moving forward in life. And I think that's what we want to continue to talk through today, of what you can do when you start feeling these signs and symptoms.
Some of the predictors of poor progression of hip OA have to do with really poor range of motion, people who have a severe amount of pain, and if there's any sort of cognitive decline or other significant comorbidities. So essentially, if you get hip OA to the point where it's severe, it's debilitating, it's limiting your range of motion, and your pain is severe, that puts you at a very poor prognosis for how it's going to progress. So the question is, how do we catch it early? How do we catch people who might be starting to develop mild to moderate amounts of OA but not have significant symptoms yet, so that they can start to be proactive? We should all be proactive about our joint health.
Exactly.
We should all be focusing on how we can keep our joints strong and healthy, regardless of how they look on the image. So how do we prepare people to do that based on the information that we have?
So we're looking at the individual's report of difficulties. We're looking at their physical limitations, their functional restrictions, their impact on participation out in the world, relevant psychosocial factors, the individual's overall health, so including any comorbidities that might be happening, and any underlying serious pathology or contraindications that can affect therapeutic exercise. So we're taking in the entire person. And I think that is what's so crucial and important to understand here. It's not just let me check your range of motion and let me see how strong you are. It's let me take in your life experiences, what's happening in the background, and all kinds of things within your life to really look at the bigger picture of what leads into pain as well.
It's going to take a lifestyle change to consistently improve your quality of life, the pain numbers, your functionality. So it needs to be something you enjoy. And that's when people have the best success or compliance in those lifestyle behavior changes. It's not like, hey, I hate strength training, so I'm going to use strength training as my primary way to improve my hip osteoarthritis. No, like you need to choose something that you're going to enjoy, whether that's bike riding, whether that's dance classes, whether that's yoga, like a variation of an exercise that you get fulfillment out of, that you take enjoyment from. That also might include some components of strength, range of motion, balance, all the things that are going to help us create a stronger and more resilient hip in the long term.
It's really important for the type of exercise to be selected directly based on the impairments or functional limitations of that particular individual. And that's why, again, we can't just say, oh, you have hip OA, or, oh, you saw it on a radiograph, here's exactly what you should do. It really should be individualized, and that's hard for people. And it's also really important that it's reproducible for you. So if you do not have access, if you go to a physical therapy office and you're using, some fancy equipment, but then you can't reproduce that at home, there's not really adherence to be able to maintain that exercise then. So what are we doing and what are we providing you that's making sure it's easy to achieve and it doesn't require some extensive equipment in order to maintain it?
And I think the research also supports that having someone to guide you through that process is much more successful than getting exercises and just trying to self-maintain a program at home.
Well, and that's why I also hate like the little exercise papers that you get at a typical physical therapy clinic. If you're getting those, make sure you're saying, okay, if this is what I'm doing, how do I progress it if I'm feeling better? How do I modify it if I'm having a flare-up? Because pain flare-ups are going to happen, especially if you're going through times of stress or you're losing someone or whatever is happening in life. That decreases our pain threshold and actually increases pain sensitivities.
Like Jen said, sometimes the exercise might not significantly reduce that pain or do so at all, but it might help you go up and down the stairs more effectively. It might help you be able to walk out to a field to watch your grandson or your son's baseball game or something like that. So if there's improvement function and the pain stays the same, a lot of the times we'll call that improvement, right? Because you can do more. Hopefully that increases your quality of life to some degree, even if the pain is not improving. And generally on our podcast, like this isn't where we're going to tell you, oh, go get a hip replacement or not. Hip replacement's honestly very high success rate, very good success rate at bringing pain levels down. They do some amazing
improving function.
Yeah, and improving function. They do some amazing things with joint replacements, especially hip replacements these days. And that's where in the type of scenario where you already have significant reduction in, range of motion, function, super high levels of pain, there might be some other comorbidities involved. That's when you might want to get with an orthopedic surgeon and say like, hey, what are my options? Because my outlook doesn't look great as far as this improving. If you're somebody who, this is where we're talking to the people with, mild to moderate symptoms or joint degeneration, there is opportunity to improve the resilience and longevity of that joint in a way that we might be able to delay a replacement if we get one at all.
One of our really good friends, Jill Miller, she actually had a hip replacement herself as well. She's not, in her 60s, but she got it because genetics for her plays a role in her tissue laxity. And she also put her joint in extreme ranges when she was doing a lot of different types of yoga, where putting your leg behind your head and doing things that were beyond the normal range of motion that we're trying to achieve. And because she already has hypermobility and hyperlaxity within her joints, it caused a lot of stress to her joints. So in her case, getting the joint replacement really helped to now improve. So she's back to HIIT training, she's back to strength training, she's back to improving her range of motion, not having any pain or symptoms, and being able to do all of these things. So it's not like you get a hip replacement and you're out for the count. You can get back to lifting heavy and being explosive and dynamic within your movement. So it depends on where you are along your journey.
There's something that we've talked about at length on different podcasts is different modalities like electrotherapy or e-stim, joint mobilizations and manual therapy.
They looked at acupuncture as well.
Especially for electrotherapy, acupuncture, they did didn't find in studies that they were as effective for bringing down pain or improving function. There was some benefit to manual therapy as far as impacting or altering pain sensation for some people, but ultimately that's not going to make the difference long term. It could provide, some relief, different manual therapies to get people to be able to do more exercise, build up strength, build up the range of motion, posture, sitting posture, shoes you should be wearing. And of course, all of these things that we do repetitively, if we're walking in certain types of shoes, that can put different pressures on our hips. If we're sitting in a way that is constantly putting our hips into extreme ranges of motion, that can impact the way that we feel or the pressures that we're putting on our hips. So of course, those are always things that we should be paying attention to and finding those times we might be putting repetitive undue stress on the hip joint.
Crossing the legs, something that a lot of women do. Are we always sitting in that cross-legged position? How often are we sitting in that?
Is it always one leg over the other?
Is it always one leg over the other? Are we strengthening in other directions? Are we moving in other directions? It's so important that it's not just about one thing or one thing you're cutting out, but what are you also including and adding? That's helping with the overall range of motion, and so that we're not getting stuck essentially in one range. And if you do need a little bit more support when you're sleeping, we have a whole sleep podcast where we talk about different positions that can be supportive for sleep to help reduce stress and pain. But if you're laying on your side, put a pillow either between your legs, or I love to use a body pillow and put my leg on top of it, because then that keeps my hips into a good alignment. Some people might need less flexion, so maybe you can't get your knee up as high, but you put a pillow between your legs and you kind of have your legs at less than a 90-degree angle, and it can help to take off some stress. If you're laying on your back, put a pillow underneath your knees, so how can you find support with those pillows to help take off some of the stress that you might be feeling?
Things about if you drive a lot and when you're in your car, your knees are higher, like above your hip level, you could sit on a pillow, especially if the seat kind of dumps back, sit on a pillow or a rolled up towel in a way that helps bring your knees a little bit lower than your hips. So again, activity modifications, finding the times that you can take a little bit of that undue stress off the hips. Ultimately, trying to summarize what we've been talking about is we need to find the plan that's best for you. We need to find the plan that you're going to enjoy the most, the exercise that specifically targets the areas that you might have deficiencies. That's why getting with somebody in person can be extremely beneficial to help set this plan in motion, and then finding some of the other things in life that we can alter. Maybe the way that we're sitting, maybe the way that we're sleeping, maybe the shoes that we're wearing.
And everything in your life, right? Biopsychosocial. So are you getting emotional support? Are your finances kind of causing you stress? How can you get support in that area? Where in your life are you adding stress? Are we not getting enough water? Are we not getting enough sleep? All of these things really impact our pain threshold. So we have to look at the entire picture when it comes to reducing pain, and we have to keep moving when it comes to reducing function. And if we can put those two in play together, I think we'll have a lot more success within our life. And of course, if you are feeling like you don't even want to get to that point, you're not sure, maybe you've had instances of feeling a little bit of hip discomfort and you're not wanting it to turn into hip osteoarthritis, we do have a hip plan on Gen Health. We have a full body low impact plan as well to help get you confident in lifting weights again and feeling good. Again, I hear over and over and over again how many people are helped and feel something different when they're moving weight in a different way and using the cues that I utilize to find how they can confidently move their body and load their body in a different way. And it's just so cool to see.
We just talked to someone recently. I'll continue to kind of like toot Jen's horn and toot the horn of the Gen Health platform, because like she mentioned, like so many people come into the platform with fear about going back into strength training or resistance training or loading their joints because they've had bad experiences in the past. And the person we just talked to recently said, Jen just says it and cues it in a way that makes sense. And she does it in a way that helps it click with my body. And we've heard that so many times from people. So if you feel like you're somebody who's like, yeah, I kind of avoid strength training, come on in. You can use code OPTIMAL. Our podcast audience can always use code OPTIMAL to get a discount on any of the courses or the membership to hop into that hip plan or the full body low impact plan to start treating that hip right and maybe building some more strength back into that body in a way that you might not have felt before. Thanks for joining us for another episode from the Optimal Body Podcast. Let us know if there's anything that you learned or if there are questions you still have on hip osteoarthritis. Also, we're always looking for more topics that we can do for podcasts or that Jen can make videos on to bring to you every single week. Make sure you hit the subscribe button and notification bell before you head out, and we'll see you next time.